So um, this one feature is obviously lacking in mobile phones, because mobile phones are going to be focusing from wherever you're standing, but only a macro lens is going to focus where, if only if you are at the accurate distance from your subject. That is the point to be taken into consideration. So please invest on a macro lens. It is going to help you streamline the workflow for dental photography and documentation. Now, coming probably to the last points, I had told you that we need to record a perfect protocol of 12 images. Let's just say 12 images for AACD. So, what are the 12 pictures? Obviously, number one, we start off with the full face pictures, and then you have the full arch occlusal images. This is so for most of the cases, I've realized that people who are doing anti-aesthetic cases, they miss out on these particular images, which is very, very important to analyze the anterior aesthetic cases. So, what all pictures are required for the analysis of anterior aesthetic cases are full face picture, full arch occlusal images, and obviously close up smiling pictures. And not only a frontal smiling, which most of the dentists record, you have to actually record the lateral smiling pictures also, which a lot of dentists fail to record, and lateral smiling also of both the sides, which is extremely important for all the anterior aesthetic cases. So, I would recommend that you actually keep one special sitting for photography if that is possible in your particular um, case situation, or you can probably select the cases that you want to document with respect to the protocol which you want to publish, and then do that case peacefully later on a Sunday or something like that. Then you want these pictures, if you can appreciate, these are disclusion pictures. One is a frontal picture and two of the sides. And obviously the most important pictures in anterior aesthetic cases is the anterior close-up images. So all these pictures together form the 12 image AACD protocol for documenting your anterior aesthetic cases. So please start having a visualization of what you're planning to document before you actually start planning. So it's better to practice. What I'm just trying to say is go into the field with blueprint in mind, so that the process is more streamlined and you have something in your mind. Now, coming to the most important thing, irrespective if you are using a mobile phone or a DSLR, it is very, very important to have the right kind of intraoral accessories. And again, you need to have some sort of standardization for documenting your cases. Again, this is a video, so what I'm just going to do is I'm just going to give you commentary about what the video is about. Um, so basically, you need to have different shapes of cheek retractors and different size of contrasters as well as mirrors. Okay. So different accessories are useful for different purposes. What I'm explaining in this video is you need to have intraoral accessories like mirrors and contrasters. They should be contra-angled, and they should be front surface coated mirrors. They should be rigid, and they should be available in different sizes. And again, um, you can see the contraster should be contra-angled, because it helps you for a little bit more retraction, which would have not been possible if it were a straight contraster. So whenever possible, try to invest on equipment which is contra-angled, because it will help you give that additional retraction. That is what I'm trying to explain. And you should also have different shapes of cheek retractors. Okay. Now I'm speaking about when to use which intraoral accessory. Okay, I stopped that video in between because you can just have a look at me directly, because it was a little frustrating for me itself, because I'm listening to that video sound and telling you at the same time. So what I'm trying to say in that video is for maximum intercuspation shots. So let me go back one slide and show you all the pictures and what are the cheek retractors that we use for all these pictures. So you can see these particular images where I'm going to be putting an arrow. It requires a different set of cheek retractors which are not useful for other images. So you need to have something called as 2C-shaped cheek retractors for these images, because of which the images documentation becomes very, very simple. So what I'm basically trying to say is try to keep favorites. For example, this shot has my favorite cheek retractor, which is called as a pair of C-shaped cheek retractors. But again, I cannot use them for these pictures. So these pictures, there are a different set of intraoral accessories for. So for anterior aesthetic cases, you want something called as two sectional cheek retractors and one occlusal contraster. So the black background that you can see over here is not photoshopped. It is with the help of a contraster. So you need to have a set protocol of which intraoral accessory also has to be used for which particular situation. Now coming to this particular image, that is the full arch occlusal image, which is probably a nightmare for most of the dentists I have seen. Again, where we have a set, protocol for this particular image, and I make sure that all my students are following this in my workshop. Is you have to use something called as two sectional cheek retractors and one full arch occlusal contraster, which is front surface coated and contra-angled. So these are some of the cheek retractors and contrasters that are spoken about in that video. One thing is missing is a molar relationship image. For that, we use something called as a V-shaped cheek retractor and a buccal contraster. That is what we call it in our magic box. Is the name of the box that has all the instruments, and the video I've exactly explained all that. So try to fix your intraoral accessories is the bottom line. Don't just randomly select any intraoral accessory. You have to have a fixed protocol of all the intraoral accessories. And now coming to the worst part, which is the image composition. Only after you do all these consistently, you are going to be very quick with your image composition. But obviously you need to have a visualization of what you want to compose. So every image has a set of a teeth that has to be seen or not seen as well in the pictures. For example, in anterior aesthetic images, you need to see mesial third of canine on both sides in the frontal image. So every image has a set protocol of what you're supposed to see and what you're not supposed to see. But in order to be very, very quick, try to do these things before you actually take the camera in your hand. So, number one is prepare yourself first. Number two is retract nicely. Number three is try to see the subject with your eyes first. Only if you're happy with what you are seeing, the camera is going to help you. There is no point of getting inadequate retraction. You're not even happy with what you're seeing, and you're just taking the camera in your hand, which I've seen n number of times in my workshops. People don't prepare themselves, they don't retract well, they don't even see with their eyes properly, and they just go ahead and take the camera in your hand. Now, the camera is not going to do any miracle when it comes to documentation if all these initial steps are wrong. So please set your workflow correctly. Prepare yourself first, in the sense the camera setting has to be on manual mode, and you have to set the right settings. The lens has to be at the right magnification ratio. Then go ahead, choose the right retractors, retract nicely, have a set protocol of what intraoral accessory you are going to use. You can basically use anything that you're comfortable with for that particular image. There's nothing like I'm here to promote my magic box, but if you're comfortable with one particular set of cheek retractors, try and use it as effectively as possible. Then next is try and see with your eyes. Are you able to see what you want to document? If the answer is yes, then only go ahead and take the shot. If you are using a mirror, try to be perpendicular to the mirror, or if you're not using the mirror, just be perpendicular to the subject and go ahead and take the shot. Um, since we are into COVID times, asepsis is of prime importance right now. So many a times the dentists do cover their camera equipment um, with uh, with a sterile glove as well. Actually, a video of this how to cover your camera and the lens with a sterile glove is there on my YouTube channel. You can have a look at it. My YouTube channel is also called Dental Photography School, and there are tons and tons of videos over there already. Now, the reason why I reinforce a lot on front surface coated mirrors all the time is so that the participants do not get images like this. Now, I'm going to annotate once again, and I'm going to use my arrow key, and I'm going to show you that this particular image has a ghost image. If you can appreciate this, please put it in the chat window. So there's a real image over here. You can see there's a real image of the tooth, and there is a ghost image around the tooth as well, which looks like a halo around the tooth. If you can appreciate it, I hope you can, but I surely can, at least on my desktop or my laptop. But this is basically happening because you have used the wrong mirrors. They are behind surface coated mirrors. So please, for documentation sake, start using front surface coated mirrors. I'm always supportive of it. And try and avoid using straight mirrors, which is one thing that makes it even more difficult. But try and get contra-angle mirrors. Very honestly, all of this is available in something called as a magic box, which is available on dentalphotographyschool.in website. So I'm going to be putting my annotations off once again. I just wanted to show you the halo effect. And I'm going to ask our organizer to start poll number 3, 4, 5, and 6 now, which would conclude my session with all of you. But let's see what poll number 3 has for all of us. Bridget, are you there? Yeah, thank you so much. So poll number 3 is, I'm sorry, right in front of you. If you have 1 lakh rupees, how would you want to invest on dental photography? This is something that I already covered in the session. Please read carefully and answer. Try to answer according to what we have already covered. So go ahead and answer this. I'm just going to play a little bit of light music till the time there is people answering this poll. All right. So if you have $1 million or $1 million, how would you want to invest on dental photography? That is the question. And there are 3 options in front of you, and I'm hoping that you will make the right choice for yourself. All right. I think we have given this enough time. Brijata, can you tell us what the people have opted for? All right. It's nice to see that 86% have realized that it is best to buy an inexpensive DSLR, a macro lens, and a ring flash. That is the right answer. Thank you so much. Let's go ahead with poll number 4. Right. So for dental photography, it is vital we take our images quickly. All right. So one method of doing this is, so you have to select one option out of the following. I repeat the question. For dental photography, it is vital that we take our images quickly. So if you want to do it quickly, you would want to use your lens on autofocus or manual focus. That is the option. These are the options. Let's see how many of you got this right, because you might get it right only if you are really attentive during the lecture. All right, let's see who has answered this correctly. All right, so 80% only could get it right, 20% got it wrong. Okay, let me try and explain this to you. Everybody can probably look at me now because I'm explaining. You cannot use your lens on autofocus because the way we document our case is using a macro lens, you remember? And we set the macro lens magnification ratio. So if you are setting the magnification ratio, obviously it's taken for granted that the lens has to be on manual focusing. Because if it were on auto focusing, the magnification ratio will change as soon as you try and take a picture. The lens ring will rotate, and that is one reason why you should not use the lens on autofocus. And if you want to be fast, take it from me, it is a nightmare to use the macro lens on autofocus. It takes a very long time. People who already have a macro lens, you can try it at home, even a not a macro lens, just a normal lens. Try to focus it inside the patient's mouth. One of the most frequent complaints is it takes a very long time for the camera's lens to focus. And the reason for that is the camera lens is really bad because with respect to what it's seeing inside the mouth, there are so many subjects, so the camera lens is not understanding where to focus. So if you want to be very fast, you should not use the lens on autofocus. You should use it on manual focus. And the fastest way to focus on your subject is go close to the subject and then come behind. And this is how we physically actually go ahead and forwards and then focus. We don't use the ring to focus. That's the fastest way to focus. So that was poll number 4, I believe. And now we go ahead with poll number 5, Dr. Brigitta. Choose one of the following. This is a very interesting question. Do give it a thought. Hopefully, this is actually not a IQ based question. It's just like a general poll that I want to understand from people. Let us see what our participants have to say. We're really excited to see this one. And really happy to see that people want to opt for ethics more than glamour and show off. That's a really good thing. So let me make one thing very clear. And the thing is, the key to good dental photography is to get consistent results. And that is the best way you can be a good dental photographer. It is not your glamour dental photography that is going to take you to the pinnacle of dentistry. It is the proper documentation that you should be capable of doing. Doing good glamour dental photography does not mean you are a good documentation expert. But if you document your case as per the protocol and you're very solid with the foundation, I'm very sure that glamour dental photography is a piece of cake. So don't judge anybody with respect to how glamorous their pictures are. Because many a times I've seen that the glamour pictures might be good looking, but they are not technically correct. So there's a very big difference between glamour dental photography and actual documentation. So we'll move on to the last question for the day. And that is, choose one of the following. Choose one of the following: documentation to record and publish, documentation to record and publicize, that is to show off a bit, and document to publish and publicize. What would be your choice? Let us see the results. All right. So 72% are saying just document to record and publish. Nobody's saying just document to record and publicize. That is really awesome to see. But the answer is actually the third one. It is really important to document to publish, yes, but it is a little bit also important to show off, in my opinion. So if you're just documenting for publication, it just becomes really boring over a period of time. In order to reignite the passion for dental photography, it is a little important to record glamour dental photography also. So what I'm trying to tell you is um, the workhorse is proper documentation for publications. But in order to just have a chill moment and actually enjoy dental photography, you need to have 10% of glamour dental photography that is going to keep you going. So both are very, very important. Please include both of them into your daily routine protocols. That is all about the polls. For people who would probably have liked my session today, which I really hope, because I've really worked hard for the presentation and I've made a new presentation for all of you all for Idea Kochi. I have my forthcoming workshops in Kerala in the month of November. So I have Cochin coming in on the November of 20, 21st and 22nd. And I have another workshop in Calicut, that's Kozhikode. It's a little difficult for a North Indian to say Kozhikode properly. I know half of you must be laughing at the way I'm saying Kozhikode. But Calicut, November 26, 27 and 28. So these are two workshops which are going to be coming up in the forthcoming months. Apart from this, I have many workshops coming in the states of Tamil Nadu, that's Chennai. I have workshops coming up in Bangalore, Gujarat, Ahmedabad, Jaipur, Delhi, and even in Kolkata and Hyderabad as well. So if you are looking forward to attend any of my workshops, I'd be really happy to welcome you all. With that, I would hand over the mic back to the organizers of the IDA Kochi branch. Thank you so much.
Thank you, Dr. Mayur Davda, for the excellent talk. Now I invite our Honorary Secretary, Dr. Nevin Thomas, for the vote of thanks. Over to you, Nevin. Dr. Nevin.
Hello, can you hear me?
Yes, yes.
Hello.
Yes.
Should whether the participants have any questions, should we ask that? Mayur, anybody can hear me?
Oh yeah, you're waiting for my approval. Sure, please go ahead. I'll be happy to answer them. Yeah.
Yeah. Okay. Fine.
Yes.
Anyone has any questions, please?
Either you can type in the chat box, or you can actually unmute and you can ask yourself. If you have any questions, participants. Please note Dr. Mayur's number so that actually you can contact him for further workshops, or anyone planning to buy any camera.
I think, Brijita, nobody has any questions. So
Yes, yes. Please note Dr. Mayur's mail ID and number. I think you can proceed with the vote of thanks.
Yeah. Okay, one question is there. Any tips for surgical photography equipment?
Yes, Dr. Mayur, one question.
Yeah. So this is by AB1. If I'm not wrong, I don't know who AB1 is. So I'll try and answer as much as possible. So for surgical photography, my first recommendation would be have the right equipment. You should have a DSLR, a macro lens, and a ring flash. Please don't buy studio lights or twin flash for surgical photography, no matter how glamorous you want them to look. Surgical photography, probably if you want to make it look glamorous, you can try for studio lights after 2 or 3 years of using your ring flash. That's my first recommendation. My second recommendation is use your flash on full power and keep your aperture according to the first image. So what I'm saying is keep your flash on full power, keep your camera settings as shutter speed of 1/200 as 100, and adjust your f number according to how your exposure is. So standardize that particular exposure and keep the f number constant. So usually I say that keep the following settings: shutter speed of 1/200, ISO 100, and f of 22. So these are the setting recommendations. And last one, for surgical photography, uh, don't think that your staff can do it. I've seen a lot of people who are doing surgeries and they hand over the cameras to the staff because they think it's better to have asepsis like that. But a better way to do it is document yourself and cover the camera with a sterile glove or a sterile, that you have a lot of plastic sterile tapes. I'm not sure what we call them. But reels kind of a thing. You can just wrap your camera with that till the time you're in surgery. And you can go ahead and do your surgical photography. But definitely, I don't recommend that somebody else does it, because from where you're standing and where you're seeing, you cannot expect the other person to see the same thing. And it's very difficult to convey what you really want them to document. So don't expect too much if somebody else is documenting for you. That is my recommendation. If you're documenting the lower arch or the region around that, it's better to document it from 7 o'clock position. If you're documenting things for the upper arch or the region around that, then it's better to document it from 11 o'clock position or 1 o'clock position. But if you're documenting an area of Leaford 1 fracture or Leaford 2 fracture, then it's better to raise yourself to a higher level and recline the patient completely in Trendelenburg position and then take the shots rather than taking it from 6 o'clock position. It's always better to record at 12 o'clock position. So these are a couple of things which might help you with your surgical documentation. Don't be scared of documenting even if your hands have blood in them. I am a firm believer that the dentist himself is the right person to document his or her own cases and not anybody else.
Thank you, Dr. Mayur.
Thank you. Uh,
Dr. Nevin,
so,
you can
yeah.
proceed.
On behalf of IDEA Kochi, I thank our speaker Mayur Davda for giving us great presentation. Thank you, Mayur. You did a great job. Hopefully, we can meet in Kochi again.
Yeah.
Also, special thanks to our president, Dr. Matthew Burgess, CD chairperson, dynamic CD person, Dr. Brijita Manon, Shereen, who helped us introduce the speaker, and also special thanks we have to mention Dr. Jayvin, who helped us have Dr. Mayur here, and we are really proud of having you. And thank you, Dr. Mayur, for giving us a great presentation.
Thank you so much to all the participants who spent their valuable evening time with me. It's almost dinner time, so I think everybody must be really hungry, including myself. So I'll be looking forward to see you in Kerala very, very soon. All of you all, the organizers as well as students.
You have the best sound also, not just photography.
I
The
am
sound setting,
thankful.
yeah,
Thank you so much
I
for
have to
that.
mention. Can I see
Thank you
that
so much.
paneling if you don't mind? Can I see that?
How do you want me to
Yes.
show
Oh,
it to you? Because I'm using my laptop
desktop.
actually.
Okay, no
Yeah.
problem.
So probably
Thank
you
you.
can give me a WhatsApp call one day,
Sure,
and
sure, sure.
I'll be happy to show my equipment. Actually,
Awesome.
carry it to Jabin Sir's clinic. Maybe you're most welcome to join me there someday.
A
Oh, cool.
Cochin, doctor, you are coming to Cochin Implant Center, right? For the
Yes, Jabin Sir's clinic.
okay,
My
fine.
courses are always over there. Yes. Yep.
Okay, doctor.
And so, what is that mic also, if you don't mind?
This mic, the model number.
Yeah.
Um. Are you an audio guy?
Yeah,
That
yeah. I am an just now audio. Too much.
Okay. So you can Google SM7B by Sure. You're muted. Yeah. So it's muted again, Nevin. I can't hear you.
No, my kids are hearing music, so I just showed my acoustic paneling inside.
Oh, okay. Sure, SM7B is one of the gold standard mics
SM7.
that you can have.
Yeah.
Yeah.
Thank
Yeah.
you. Thank you, Mayur. Thank you.
Thank you. Yeah.
Good night. Take care.
Thank you, Matthew, sir. Thank you, Brijita.
Thank you, Dr.
I'll be
Mayur,
looking
and
forward to
thank you,
see you
Dr.
in Kochi.
Jabin, for
Thank you,
arranging
Jevin, sir. Yeah.
for us.
Yep.
Okay,
Yep.
let's see in
Thank
Cochin
you.
next time. Thank you so
Yeah.
much.
See you. Yeah.
Bye.
Bye-bye. Bye.